Our project today is on suicide prevention. It will be presented by Alicia Ruffins, Heather King, and Cora Johnson. Talked about in this slide will be the demographics of suicide. The rate of suicide is highest in middle-aged white men. In 2019, men died by suicide 3.63 times more often than women. White males accounted for 69.38% of suicide deaths in 2019. Females have more suicidal thoughts, and suicide was the second leading cause of death among individuals between the ages of 10 and 34, and the fourth leading cause of death among individuals between the ages of 35 and 54. This slide will be talked about the definitions of suicide and introducing the 4 types of suicide. Suicide is death caused by injuring oneself with the intent to die. The 4 different types of suicide, according to Emil Durkheim, are egoistic suicide, altruistic suicide, anomic suicide, and fatalistic suicide. Egoistic suicide is when an individual becomes socially isolated or feels that they have no place in society. They destroy themselves. This is the suicide of a self-centered person who lacks altruistic feelings and is usually cut off from the mainstream of society. An example of this would be when someone with no one in their life commits suicide. Altruistic suicide occurs when individuals and the group are too close and intimate. This kind of suicide results from over integration of the individual into social proof. An example of this will be when a soldier jumps on a grenade in order to save others, yet kills himself, or a terminally ill person commits suicide to save their family and friends from watching them suffer. Anomic suicide is due to a certain breakdown of social equilibrium, such as suicide after bankruptcy or after winning a lottery. In other words, anomic suicide takes place in a situation which has cropped up suddenly. An example, besides the ones above, would be when someone gets divorced and loses their children. They commit suicide because they feel as if they have no hope. Fatalistic suicide is a type of suicide occurs when a person is excessively controlled and oppressed. An example of this type of suicide would be when someone is stuck in an awful situation and just wants to get free, such as a person in an abusive marriage that sees no way out. The current cost to society of suicide is there's always an economic cost associated with suicide related to medical and work loss cost. According to the CDC, suicide and suicide attempts cost society about $70 billion in 2018. The average cost of just one suicide is nearly $1.5 million. This estimate combines medical expenses and costs due to work loss. Suicide prevention programs, particularly those that also focus on building community resilience after a suicide, may help reduce the economic and emotional cost. The cultural difference of suicide are suicide rates in the U.S. are lower among ethnic minority populations than among European Americans. American Indians and Alaska Natives had the highest rate among any ethnic group in the country. All cultures have their own opinions and ways in which they deal with suicide. Some risk factors that can prompt suicide thoughts come from the culture itself. For example, Asian Americans say that the loss of their face, such as shaming the family name, can bring on suicidal thoughts. Asian Americans are taught to not let their family down, very much like the Americans that I know. The generation coming up still feel those generational curses of not letting people know how they feel, but every generation is getting better and better at telling people just how they feel. The socio and economic issues of suicide are, there's tons of them actually. The highest relative in population attributable risk of committing suicide for males in low-ranked occupational classes and for persons with low educational achievement. Regarding relations of education and suicide, suicides were also 2.12 times more often observed in the lowest educational group as compared to individuals with the highest educational levels across 35 countries in a study combining census and mortality register data.
Okay, so we're going to get talking about the history of suicide. Throughout the years, suicide trends in the United States have fluctuated. In the 1860s, hanging was the #1 method of suicide. In the 1900s, poisoning was the #1 method of suicide. And from 1910 and every decade after, firearms make up as the main method of completed suicide. Depression is the most common illness in people who commit suicide. According to DSM-5, the following criteria must be met in order to receive a diagnosis of major depression. So on the table to the right, you see that 5 or more of the following symptoms should be present daily for most of the day for at least 2 weeks. At least one symptom is either depressed mood or anhedonia, changes in appetite or weight, insomnia or hyperinsomnia, psychomotor agitation, retardation, fatigue or loss of energy, feelings of guilty or worthlessness, difficulty with thinking, concentration, or making decisions, and suicide ideation or suicidal attempts. Some of the precipitants, this slide's over the precipitants of symptoms of suicide. Martunen and others discovered some participant stressors in adolescents between the ages of 13 and 19. In comparison to other victims of suicide, those who had weakened parental support were reported to have an increased risk of suicide. Further research implicates stress as an important precursor to adolescence. In comparison to younger adults, older adults are more prone to using more lethal means to complete a suicide. Additionally, older individuals are less likely to survive their suicide due to their physical stature and age. Other age-related precipitants include isolation and age-related illnesses. This slide goes over the individual risk factors. One would be prior suicide attempts, substance use disorder, mental disorders such as depression or other mood disorders, access to guns or lethal means, social isolation, lack of access to behavioral health care, chronic disease and disability, legal problems, aggressive or impulsive tendencies, and job loss. On the relationship side, we have family history of suicide, relationship issues, sexual violence, and child abuse and neglect. Community and societal risk factors include inaccessible healthcare, cultural differences, suicide clustered in the community, spring and summer seasons, being male, elderly, or Caucasian, accessible lethal means, and stigmas that are tied to mental illnesses and receiving help. Here are some of the warning signs of suicide. It's extremely important to take any suicidal thoughts or behaviors seriously. Knowing the warning signs and being able to recognize them will help you respond better. Some of these signs include helplessness, talking about suicide, focusing on death, actively searching for lethal means, self-hatred, self-destructive behavior, saying with goodbye, withdrawal, and getting affairs in order.
When it comes to behavioral treatments, there are many different types of treatments used when it comes to suicide prevention. Shaping is one that we have gone over throughout this semester. And I believe this could be used as a behavioral treatment for suicide prevention so that it can build upon coping mechanisms, as that's a behavior that's wanted. Other types of very common behavioral treatments for suicide prevention is dialectical behavior therapy, or DBT, and cognitive behavior therapy for suicide prevention, CBTSP, are the most common and the most used. So with DBT, it aids in one learning about their own triggers. So those that will be the trigger to a suicidal thought, behavior, or episode, as well as assessing which coping mechanism would be the best one to use when dealing with your suicidal thoughts or behaviors that occur. With CBTSP, it teaches how to cope through cognitive, behavioral, and interactional skills, and it uses problem solving and management skills when the person becomes distressed and emotional.